A lot of what I do is thinking about everything that makes a person healthy, so not just the medical care we give, but how patients get food, how they get to their appointments, how they get their medications, how they can take their medications, and all those factors that contribute to challenges with those things. And so part of what I'm interested in doing is thinking about what kind of interventions we can design to make the everything else that contributes to what makes a person healthy work better. So some of the things that we think about are using patient navigators, using people who have lupus to promote lupus education, to inform members of their communities and members of their social networks about the importance of getting care for their lupus. Another program that we have going on right now is using nurse managers who are specifically helping patients who have a lot of ED visits, emergency department visits, or hospitalizations be able to access the kind of care in the outpatient setting that they need: mental health care, social services, transportation, their medications, in order to make it so that they can stay out of the emergency room and able to receive good preventive care as well. Some of what we're doing now is identifying patients who have needs beyond what they would normally get just from seeing their physician, and really trying to understand what those needs are and providing the resources so that they can get them. So for example, patients who miss a lot of their outpatient appointments, actually going back to them and saying, well, why did you miss your appointment? Not just can I reschedule, but why did you miss it? And then when we find out it's because they can't afford parking or transportation, trying to figure out how we can meet those needs so that they're able to come to their appointment. So thinking about what sort of tangible strategies we can use to help patients, for example, finding out that a reason a patient doesn't take their medication is because they have to take it with food and they don't have consistent access to food, and really thinking about how we can change that so that patients are able to both be healthy and eat and take their medications. And I think one of the things that I've learned is that if you don't ask the right questions, you're not going to get the answers, and so you're not going to really be able to address the root causes of why patients are not getting better. And I think one of the things that I've been learning is the more you ask, the more you learn, and then the more you can do about those things.